When we look at how things are going related to COVID-19 in the state of Massachusetts, we actually have a lot to be optimistic about.
We've done a phenomenal job of getting our rates of transmission down. We are viewed around the country as a leader in developing strategies to reduce the spread of infection. Getting our kids back to school is really only safe because we've gotten the rates of transmission down to a low level, low and continuing to drop. If we were in another state, we'd be having a different conversation. There will be important measures that are going to be implemented at each individual school to make sure that kids stay safe, kids and teachers. One of them will be social distancing. We're going to keep kids apart. We're going to rely heavily on the use of masks, which we know are highly effective at reducing transmission. We're going to rely on hand hygiene. We're going to really require children to be washing their hands or using hand sanitizer frequently over the course of the school day. So one of the most important things that parents and families can do to support safe return to school is ensuring that they're only sending their children to school when they're well. Every day we want parents to ensure that their children don't have any symptoms that could be a sign of COVID. We know that classrooms are going to look different than they did last year. They're going to be configured in a way that's going to maximize the safety to both students and to teachers. The first difference that will be noticed is that the desks are going to be spaced further apart. We know that not every classroom will be able to achieve 6 feet of distancing, and that's safe provided that children who are in those classes, as well as the teachers, are wearing their mask. In addition, they're all going to be facing forward because we know that sideways transmission is rare. And with those strategies in place, distances shorter than 6 feet can still be done safely.
So because of what we've learned about the virus itself, we feel comfortable that the plans that have been outlined are a safe and effective way for our children to return to school this fall.
I'm an infectious disease physician, but I'm also a mom, and there is nothing more important to me than the safety of my kids. I really believe that we're putting together strategies that are going to protect our kids and the educators in the classroom to make it safe for them to go back to school. My children are going to be going back to school in the fall, and I am really confident that they're going to be fine.